Hi, and welcome to another edition of Data with Dylan. I'm Dylan Steigerwald. I'm the epidemiologist for the Jefferson County Health Department, and today we're going to be taking another look at the weekly COVID-19 surveillance report. So today we're going to be looking at the week 24 report. Week 24 goes from June 7th through June 13th. During week 24, we had a total of 15 confirmed and probable COVID-19 cases reported in Jefferson County, and that brings us up to a year-to-date total of 428 confirmed and probable cases. We remained at 20 COVID-19 associated deaths within the county, and we're still at 6 outbreaks of COVID-19 reported in our long-term care facilities. Those are our nursing homes. All right, going down to table 1, we're looking at the number of confirmed and probable COVID-19 cases by week. As you can see, 15 cases for this week, bringing us up to that total of 428. Going down to figure 1, looking at it more visually, we can see that week 24, 15 cases, down from 56 the prior week. Moving on to figure 2, we're looking at cumulative confirmed and probable COVID-19 cases by week. We're still slowly climbing up the number of cases here. Figure 3, we're looking at the age-adjusted case rates in Jefferson County for COVID-19, and we still see that if we're going by the raw number of cases, we see the most cases within our 50 to 59 and 60 to 69 age groups. But then if we adjust those for age, we see that the highest rate is actually in our 80 plus age group by a wide margin. That age group has a case rate of 71.8 cases per 10,000. Figure 4 shows the COVID-19 hospitalizations and hospitalizations rate by age group. And we can see the most hospitalizations have been in our 50 to 59 and 60 to 69 age groups. But the highest rates, again, are kind of skewed more towards our more elderly age groups here, with the 60 to 69, 70 to 79, and 80 plus having the highest rates per 100. And again, when you look at a rate per 100, that's the same thing as a percent. So for our 60 to 69 age group, 21.5% of the cases have resulted in hospitalizations. Figure 5, we're looking at fatalities and the fatality rate by age group. We can see most, if not almost all, of our fatalities have been in our age groups 60 years and older, with our highest rates, again, in our most elderly age groups here, 70 to 79 and 80 plus, have about 15% each of those cases ending in fatalities. Going down to table 2, we can look at the approximate cumulative fatality rates for Jefferson County. And that's taking the total number of confirmed and probable cases, the total number of confirmed associated deaths, and getting a percent from those. We actually decreased our fatality rate a little bit from last week, but we're still hovering around 4 to 5%. I think as we get more testing done, that number will continue to decline. Going down to figure 6, we're looking at COVID-19 cases by sex, and we're seeing a larger proportion of our cases are in females. And again, from last week, a reminder that Jefferson County almost has an even 50-50 split of males and females. So that ratio holds out true even if you look at the proportions. So we have more females with COVID-19 than males. And I'll talk a little bit about that when we look at our numbers excluding long-term care facilities. Figure 7, we're looking at COVID-19 PCR test results by week. And we're looking at also the number of positive and negative tests done, and then the percent positive. How many of those tests are coming back positive? And we get that number by taking the number of positive tests and dividing it by the number of total tests done for that week. And we can see that we had an increasing percent positive rate up until about week 17. And since then, we've kind of declined. and have had a low percent positive rate. And it's good that we see that low rate as we increase the number of total tests done. That's an indicator that we have a more adequate number of tests available and being run in the county. Table 3 is the chart of those numbers by week. You see the positive tests, the number of negative tests run, the total tests run, and then that percent positive again. And we decreased from week 23 to week 24 in our percent positive. Table 4 is looking at COVID-19 cases and rate by race, and this is per 10,000 residents. So we see the highest total number of cases in our white population, but then if we look at our rate per 10,000, we see that our black population has a higher rate at 29.7 cases per 10,000. Figure 8 is the graph, the visual representation of those case rates by race per 10,000. And those are self-reported races when we do our investigations and follow-up interviews. Figure 9 is COVID-19 cases by zip code in Jefferson County, and this is the raw number of cases per zip code. We can see by far 63028, our Festus area, has had the most cases with, and that's mostly because we've had a couple of our long-term care facility outbreaks within that zip code. So that really raised the number of cases for that area. Figure 10 shows the number of COVID-19 cases by zip code per 10,000 residents, and this is looking at the rate here. And we still see that the 63028 area, our Festus area, is one of our highest affected. And again, that's probably because that's where a couple of our long-term care facilities have had rather large outbreaks. Figure 11 is looking at the map, and the darker shades of blue here represent a higher total number of cases. And we see again our 63028 area with one of the darker shades of blue, and also our Arnold area and the zip codes around our Arnold area, which we might expect because it's closer to St. Louis, a more densely populated area. So we would expect more cases to come from those places. So we've also put out a report of our weekly COVID-19 cases, but we took out all the cases that are associated with our long-term care facilities, our nursing homes, because we wanted to get an idea of what do the case rates look like excluding those numbers. So if we look at our total number of cases, we see that 37% of our cases have been in long-term care facilities, so quite a large percentage, and that's about the same percentage that we've seen throughout the United States. A lot of these cases are coming in our elderly populations and within our long-term care facilities. So we see excluding those long-term care facility cases in week 24, we had a total of 13 cases, bringing us to a total of 269 cases excluding long-term care facilities. And one thing I wanted to point out, if you look at figure 3, so we're looking at our confirmed and probable COVID-19 cases. This is our age-adjusted rate, excluding long-term care facilities. We see that the rates for our two most elderly age groups, 70 to 79 and 80 plus, drastically go down during if we exclude those long-term care facility cases. And that's something we would expect because we have more of those elderly populations within long-term care facilities. So with excluding those, we see our highest rates in our 50 to 59 and 60 to 69 age groups. And that goes along with the raw number of cases. Another thing I wanted to point out, if we look at figure 6, COVID-19 cases by sex, excluding long-term care facilities, we see a, a more even split between our male and female cases. And there might be multiple reasons for that, but one of them, I believe, would be because females live longer in general. So we have more females living longer and in our long-term care facilities. So when we exclude those numbers, we see that that split is actually more even between males and females. Going down to figure 9, we're looking at the cases by zip code, again, excluding long-term care facilities. And we see once we take those numbers out from our nursing homes, the 63028 Festus area really goes down Over 70 cases in that zip code were associated with long-term care facilities. And that plays out if we look at figure 10, and that's cases by zip code per 10,000 residents. We see that the Festus 63028 area is no longer our highest affected area. We see other areas, 63016, 63019, and 63070, higher than the Festus area. And that will conclude this week's Data with Dylan. Stay safe, Jefferson County.